This particular topic, unlike or much like Social Security, is pretty confusing. So my goal is to try to unconfuse you as much as possible. Just to review, I work for IES, which is an acronym for Infinite Educational Strategies. It's a nonprofit organization, and our job, our mission is simply to educate people about financial issues. I do Social Security and Medicare. Other teachers, and by the way, most of the people in our organization are ex-teachers, they do taxation, they do trusts and wills. Our purpose is to educate people, and we don't charge for that. I know that sounds crazy, but again, organizations like Rockwood Bank, several other organizations support us, and also we hope to get some government grants to support us also in what we do. It's very rewarding for us because we're not salesmen. We're not going to sell you anything. In fact, if you ask me afterwards, should I buy an Advantage plan or should I buy a supplement or what should I do? More likely than not, I will tell you I don't know what you'll do because I don't know your financial situation. So again, this is not a sales pitch. This is simply and purely educational. In your packet, you will notice there is a sheet with Medicare key terms and phrases. I'd like you to keep that out and handy because we're going to be referring to a lot of these. And that way it'll save you some writing also. Then there is another packet which will basically not cover every slide up here, but cover a lot of them. So, and I'll refer to this packet too. And then there's a blank sheet where you can take notes if you so desire. Steve Miller, my associate, is here, as he was last time with Social Security. We'll be happy to stay around as long as you want us to afterwards to answer any questions. Hopefully, we'll be done by 7:30 at the latest, and then we'll stick around, as I said, for questions. Just a disclaimer again, I am not here to sell you anything. I'm not trying to push one product over the other. I'm going to talk about two different options, both of which are excellent, depending on your circumstance. So we'll refer to the Advantage plans and supplements as we go along. A brief history of Medicare. 1965 is when it was begun. There were two parts to Medicare in 1965. And this is known as Original Medicare. Keep that phrase in mind, Original Medicare. Part A covered hospital, skilled nursing, hospice, and home health. You paid taxes, as it were, for Part A through your working career. They took it out of your check. You probably didn't even know it. So most of us do not pay any monthly premium for Medicare Part A because it's been taken out during our working career. Part B covers anything that's not in the hospital, skilled nursing. It covers doctor's visits, outpatient services like x-rays, blood tests, mammograms, colonoscopies, urgent care center, emergency room, anything not where you're admitted to the hospital. There is a cost for Part B. That cost varies depending on your income. It could go up and down. Now, Medicare today has two more parts that they didn't have back when it began. Medicare Part C is also known as Advantage, Medicare Advantage, Medicare Choice. We'll talk about that. That was begun in 1997. Up until 2003, if you had to take drugs and you were in the hospital, Part A covered it. If you were taking drugs in the doctor's office, in an emergency room, Part B covered it. But if you were taking prescription drugs at home, you weren't covered. And that was really, really a tremendous blow to seniors, particularly those who were sick. So when Part D was begun by one of the Bushes in 2003, it was a great thing for us seniors. And we'll talk about that later on. So what Medicare is today is 4 parts. And that word part is important because later on, we're going to talk about Plan A, Plan B, Plan C, Plan D. They're not the same. And that's where confusion lies. Part and plan are different things. So these are the 4 parts. We're going to talk about plans later on. Part A and Part B does not cover everything. There are gaps in the coverage. So the key question becomes, how do you cover those gaps? All right? Part A and Part B are automatic if you are on Social Security. You are automatically enrolled when you're 65 in Part A and Part B if you are taking Social Security. If you are still working and don't want Part B because there's a premium, when you get the information from Social Security about Medicare enrollment, you would then have a card that says if you don't want Part B, and if you're working, you don't need it, then send this card back. Make sure you do that, or else they'll start, if you happen to be taking Social Security, they'll take it out. If you are not on Social Security and you turn 65, and some people don't start their Social Security, as we talked about last time, until they're 66 or 67 or whenever. But if you're not on Social Security, you must proactively enroll in Medicare A and B. You have to do it yourself. You won't get a letter reminding you. You have to do it yourself. So you have to call Social Security, go into the office, or go online to do it. Now, there are several enrollment periods. They're explained in detail on this sheet here, but the initial enrollment period for Medicare Part B is when you turn 65, 3 months before, 3 months after. So a 7-month period to enroll in Medicare Part B. And if you enroll in Medicare Part B 3 months before, you begin Part B when you turn 65, the month you turn 65. If you wait till the month you turn 65, then your enrollment gets delayed. So if you enroll in the first 3 months, you start the month you turn 65. If you enroll in the latter 3 months or the month you turn 65, your enrollment period when you start is going to be delayed. Just remember that. And I could explain that in more detail if any of you enroll late. There is a special enrollment period. Let's say you didn't sign up for Part A or Part B because you're still working and you're covered under the work plan. Well, you got a special enrollment period then. When you quit working and quit coverage from work, you can enroll in Part A or Part B without any penalty because you have a special enrollment period. So keep that in mind. That's why I said, if in most cases, if you are working and you turn 65, there's no premium for Part A. So most people sign up for Part A. It just kind of gives them extra coverage. Now, there's a time when you wouldn't sign up, but I'll explain that later. But if you're working and covered by your work plan, you don't need Part B. Why pay that $104.90 a month for Part B if you don't need it? So then you wait until you quit working to sign up for Part B. All right? Now, there's a general enrollment period that goes from January 1 to March 31st if you miss those first two. But if you enroll in that general period because you missed the first two, you don't start till July 1, so there's a gap in your coverage. My point is, enroll when you're supposed to. Either when you turn 65 and quit working, or when you are working past 65 and then quit working, enroll. Then you won't have any problems. We'll talk about that later. All right, now, there are two ways to get your Medicare benefits. One is called a Medigap or supplement way. The other is called Medicare Advantage. Two ways to get it. Now, under Medicare or original Medicare, Medicare supplements or Medigap, the government drives the bus. I want you to keep that image in mind, my little cartoon here. The government drives the bus. The insurance companies are along for the ride. The insurance companies do what the government tells them. It's going to be just the opposite for the other. Advantage plans are just the opposite. The insurance companies drive the bus, and the government blesses them and gives approval. So, original Medicare, government drives the bus. Medicare Advantage plans, the insurance companies do. And I'll explain the differences between the two. All right, here is a brief summary of the differences. Then we're going to go back and talk about them. Under Medicare, original Medicare, Part A, Part B, there are gaps. How do you cover the gaps? You buy a supplement or a Medigap policy. What are those like? There are 10 standard policies. Who drives the bus here? The government. The government makes up the plans. The insurance companies can't make up their plan. They have to sell the plans the government tells them to. There are 10 plans set up by the government. These are standardized, which means if you buy a plan, and by the way, the plans in the government's infinite, I was going to say wisdom, but it may be stupidity, in the government's infinite stupidity to confuse us, they didn't name the plans blue, white, red, or Kansas, Wyoming, or what. They named them Plan A, Plan B, Plan C, Plan D. And people say, well, I signed up for Plan B. I'm paying $100. I said, no, you got Part B. And Part B doesn't cover everything. There are gaps. So you need a plan. It's possible to have Part B and Plan B. It's possible. So there are 10 standardized plans. Notice the names of the plans. A, B, C, D. You know your alphabet like I do. F, G, K, L, M, and N. And so if your knowledge of the alphabet is as good as mine, you begin to say, where the heck is E? Where's H? Where's J? Where's I? There used to be those plans. Back in 1965, this was begun. Through the years, the government has dropped some plans, and they've added new ones. The newest ones are L, M, and N. Those are new ones, recently added within the last 5 years. Those people that had a Plan J, had a Plan H, they were grandfathered in and allowed to keep them. I mention that because President Obama and Congress right now is discussing whether to drop some of these plans. And for those of you that happen to have one of those plans, if you like it, I can't say with 100% certainty that you'll be allowed to keep it, but if history is any clue, those people that had these plans that were dropped were allowed to keep them. They just didn't sell any new plans. So keep that in mind. So these plans are standardized, which means if you buy a Plan F from United Healthcare, if you buy a Plan F from Coventry, if you buy a Plan F from Blue Cross Blue Shield, they offer the same benefits. It's exactly the same. Because who drives the bus? The government. And the government tells them, here are the plans, you can't waver, you can't make up your own plans, here's what they cover. So you have to understand that concept. The insurance companies charge a monthly premium for the plan. Now you would think, in our government's infinite wisdom, since they standardize the benefits, you would think they standardize the price. No. So, your favorite insurance company is Anthem. You pick up the phone and call Anthem and say, I want Plan F. What are you going to charge me? And Anthem says, how old are you? You say, I'm 65. All right, we're going to charge you $185. So you say, all right, sign me up. But failing to realize that had you called Stonebridge or Mutual of Omaha, you could have got the same Plan F for $160. Same plan, same benefits, different price, because the government counts on us, the consumer, not doing our homework, not making the necessary phone calls, not doing the necessary homework. That's what they count on. By law, these plans cannot cover drugs. So even if one of these insurance companies selling one of these plans wanted to cover drugs, they cannot, because the government drives the bus. So if you buy one of these, you then got to buy a stand-alone drug plan, a separate drug plan. Does not have to be from the same insurance company. It could be different. This plan I'm calling, or this procedure I'm calling a pay now process. You're going to pay a monthly premium for these plans, much like you pay a monthly premium for your car insurance, your homeowner's insurance. You hope like hell you don't have to use it, okay? But you're going to pay every month. So this is a pay now plan. Just remember, homeowner's insurance, car insurance, Medigap, Medicare supplements, original Medicare. That's what you're going to do. Very important concept. These plans follow Medicare. Here's what I mean by that. Any doctor, any hospital, any medical provider, somebody who sells wheelchairs or iron lungs, any of those people that take Medicare, they must, by law, take your plan because the government drives the bus. They can't say you're in Philadelphia on a trip, you go to the emergency room, you bought a Plan F from Anthem here in St. Louis, you show the emergency room your card, they say, we're not taking it. They can't do that. They have to take it by law. So, I like to say these plans follow Medicare. There is no network. You can use anybody in the United States of America who takes Medicare. How many hospitals take Medicare? 100% of the hospitals in the United States take Medicare. So they have to take your plan. How many doctors? About 90%. Some people say it's going to go down because of some of the money that Medicare is paying them. But today, about 90% of the doctors take Medicare. So if they take Medicare, they got to take your plan. They can't say, I'm not taking Coventry's Plan K. I'm not taking Mutual of Omaha's Plan C. They can't say that. So keep that in mind. Very important. These plans follow Medicare. Now, opposite this is something called Part C, Advantage plans. Let's look at the differences. 10 standardized plans set up by who? Government. Hundreds of plans set up by insurance companies. The insurance companies can make their own plan. Big difference. Big difference. These plans are standardized. You know what you get if you buy Plan C. We're going to talk about that in a minute. You know what you get if you buy Plan K. You know what you get if you buy this. Here, every insurance company makes up their own plan. You better read the doggone plan so you understand, because this insurance company's plan may be different than this one. They're different. I'm not saying they're bad. In fact, some of them are really good. They don't name their plans A, B, C, D. Most of the insurance companies name their plans like Gold, Complete, Comprehensive. They give them special names. Here's how these work. Back in 2003, when these were set up, the insurance companies went to the government and basically said, you're screwing up Medicare. You're not in the business of insurance. You're in the business of government. Why don't you let us, who are in the business of insurance, make up the plans and run Medicare? They negotiated for months, years. I am sure money went under the table. I'm sure there were payoffs. What was born was Medicare Part C Advantage plans. Here's how they work. For every person that the insurance company signs up for one of their Advantage plans, the government gives a monthly subsidy, a monthly premium, as it were, to the insurance company and says, take care of this person. Get what I'm saying? The government pays the insurance companies a monthly stipend or subsidy to take care of you if you sign up for one of these plans. How much is that? Make a guess. Rich, give me a number.
$1,500 a month.
That's high. That's really good. High. It's not 100. It's not 200. It's not 300. It's more like 800 and something a month to take care of you. The insurance company takes that money from the government and sets up a plan and hopes like heck, what? You don't get sick. You don't get real sick, because then they pocket that money. Now, you might think, well, is the government stupid for paying these insurance companies that much money to take care of you? Not really, because over here, the bulk of expenses the government has to cover. Over here, what the government did is said, like if I sign up for one of these plans, the government's saying, hey, Rich Grawer's off our government rolls now. Now he's the problem with the insurance company. So understand, that's why, for those of you who are on Medicare and on an Advantage plan, what's your monthly premium?
Nothing.
What is it?
Nothing.
Nothing. Most of these plans do not charge you a monthly premium. Why? The government's paying them. And the insurance companies are driving the bus now. So most of these plans have zero premium. And that sounds really good. And it is. Because they get that monthly premium of $800 and something a month to take care of you, the insurance company wants to entice you to sign up for the plan. Nothing wrong with that. Kohl's, Target try to entice you with sales. So these plans cover drugs. These plans cover vision. These plans cover dental. Some of these plans even give you a free gym membership in Gold's Gym or Curves, the YMCA. They want you to sign up for these plans. So they include extras. And many of you probably were wondering, how can they do that and not charge me? Can you see why now? The government is giving them money to take care of you. So, whereas these plans you're going to pay now, you're going to pay a monthly premium. Over here, you got no monthly premium, but you pay as you go. Every time you use a service here, go to the doctor, go to the emergency room, go in the hospital, there's going to be copays and deductibles. And those copays and deductibles are going to be different because each insurance company designs their own plan. Okay? So they're going to be different, pay as you go. Most of these plans also are HMOs, which means they have a network. What's the network over here? There is none. The United States is a network. Over here, there's a network of doctors and hospitals that you have to use in order to reap the best benefits of the plan. I am not saying that's bad, but there's a big difference. So again, look at the differences. You got a choice. Remember, Part A and Part B does not cover everything. There are gaps. Do you want to pay a monthly premium and have the freedom to go wherever you want to go in the United States of America to whatever doctor, hospital, or specialist you want, but you're going to pay a monthly premium and maybe some other charges? You're not going to have a drug plan. You got to buy a separate drug plan. You're not going to have a vision plan. Got to buy a separate vision plan. Or do you want one of these where you pay no monthly premium? You're going to pay as you go. If you're really healthy, you may pay nothing. You're going to have drugs, vision, and dental, and some extra benefits included. Those are the two choices you have. Now, I'm going to go into more specifics with each one. I'm going to start with this one. Not that this one is better. This one is a little bit more complicated in a sense. You'll see why. All right, you have a chart in your booklet. Let's turn to that. It's colored. All right, it's this page, the colored page. Up at the top are the 10 plans. You with me? A, B, C, D, F, G, K, L, M, and N. Those are the 10 plans. On the left-hand side are all of the gaps in original Medicare. For example, if you are in the hospital between 61 and 100 days, it's $315 a day that you have to, somebody's got to pay it. That's a gap. If you go to the doctor's office, Part B, that's a doctor's part of Medicare. Medicare pays 80%, you pay 20%. That's a gap. So if the bill's $100, you're responsible for 20. If you go into a skilled nursing facility, you break a hip, you have to go to learn how to walk again. They send you to a skilled nursing facility. The first 20 days are free. I just had a friend who, God, he weighed almost 500 pounds. And he had knee surgery. He could barely walk. They sent him to skilled nursing. He was there past 20 days. Every day past 20 cost him $157.50 a day. That's a gap. So on the left-hand side are all the gaps. Believe me, trust me, they are all the gaps in Medicare. I've been on Medicare, so I know that's all the gaps. Plan A covers, look at the green check marks, 1, 2, 3, 4, 5, 6 of the gaps. It does not cover these gaps. Plan B covers all the gaps that are check marked in green, except it doesn't cover the skilled nursing facility, doesn't cover the Part B deductible, there's a deductible there, doesn't cover what is called excess, doesn't cover foreign travel. You see where we're going with this, ladies and gentlemen? Every plan covers things differently, but they all are standardized, meaning if you buy a Plan B from Coventry, if you buy a Plan B from Mutual of Omaha, they got to cover those. They can't cover the red X's. They can't. Government drives the bus. Now, you will notice there is one plan that covers every single gap that Medicare has. I give you a clue. Look at your chart. Which plan is it? F. So Plan F is the most comprehensive. I tell people, write the word Rolls-Royce, Cadillac, whatever you want, to indicate it is the most comprehensive and the most popular of all these plans. More people buy F, if you're going to go with the supplement, than any other plan, because it covers everything. There are no copays, there are no deductibles. It will cover everything at 100%. But you're going to pay a monthly premium for it. And just make an educated guess here. The plan that costs the most will be the plan that covers the most. The plan that costs the least, an A, maybe a K, because it doesn't even cover everything at 100%, 50%. Those plans cost the least. Now, people are always saying, well, give me a general idea. What does it cost for a Plan F? And it's going to depend on the age you are at when you start, but let's say you're 65. My experience has been Plan F's range from about $165 a month to about $200 a month. Notice that range. Why is there that range? Because the insurance companies can charge whatever they want. So the question would have to be, why would I buy a Plan F that costs $200 a month? We're not going to buy a Plan F that costs $165. The answer is, most people don't know any better. They don't know to do their homework. They buy a plan from their favorite insurance company. Nothing wrong with that, but you may be spending $30 more a month, which could add up. Okay? So you're with me on this. And I'm not going to talk about every plan because that would take forever. We can talk about the most comprehensive because it's the most expensive. If you want to downgrade, the price will go down. The price will go down. F is at the top. All right? Again, if you buy a Plan F from Anthem, Coventry, United Healthcare, it covers the same thing. Has to. The government drives the bus. Okay? Now, remember, here's what's not covered by any of these plans. Plan F does not cover, by the way, I should say this too, Advantage plans and any of these plans, none of it covers long-term care, nursing home. None of Medicare covers nursing home. Okay, just keep that in mind. It does not cover prescription drugs, does not cover vision, dental, hearing. Of the three, this is the most important. So you got to buy a separate drug plan. All right, here's what the government did with prescription drugs. They set up a basic, bare bones drug plan. They told all the insurance companies, here's the plan. You guys can make it better, can't make it any worse. We're setting up the basic minimum plan. All the insurance companies, whether you're here or whether you're with an Advantage plan, they have to abide by these rules. All right, what are these rules? Well, first of all, here's how the plans work. Again, government's wisdom here. The insurance companies negotiate with the pharmaceutical manufacturers a price that the insurance company will pay for the drugs. Okay? The insurance companies then set up a formulary, what drugs we're going to cover. The insurance company then ranks the drugs. Tier 1, generic. Tier 2, a little more expensive. Tier 3, more expensive. Tier 5, brand name, very expensive drugs. They set up their own formulary. Each formulary is different. Each formulary doesn't cover the same drugs. Each formulary may cover the same drug, different prices, because the pharmaceutical companies and the insurance companies negotiate. People have argued, why doesn't the government negotiate and have a standard price for all drugs? They do it for the military. Why don't they do it for us? And the answer is money under the table again. It's probably not going to happen. All right, here are the stages for that plan. Here's that plan the government sets up. Stage 1 is a deductible stage where you pay the first $320 for your drugs. Or they can make it better. I got a plan where the plan waives the deductible. I have no deductible. I did my homework. I found a plan with no deductible. So I jump into stage 2. But if you got a stage 1 where you have to pay a deductible, you pay the first $320. Then you're in stage 2, which all of us are used to doing. We go to the pharmacy, we get our drugs, we pay a copay. That's not the real cost of the drug. That copay may be $10, but that drug costs $40. Okay? But you're only paying $10. When you add up the total cost of your drug, what you pay and what the insurance covers, and it equals $2,960, you're out of stage 2. So you just can't look at what you're paying for the drug. You got to look at what the insurance company pays for the drug. How do you know? Because by law, you get a monthly statement that tells you. You know what most people do with that statement? They throw it away. I look at it. I've never been out of stage 2. Most people are never out of stage 2. Got to be pretty sick, take a lot of heavy drugs to be out of stage 2. If you and the insurance company have spent $2,960, you're out of stage 2 and you're in the infamous donut hole, or gap. Now, up until, and I'm not trying to test your political affiliation here. That's not my intent. But Obama's Affordable Care Act basically doesn't deal with us seniors. It deals with pre-65-year-olds. But there is a section that deals with us specifically, and it's with this donut hole. Here's the donut hole before the Affordable Care Act. If you fell into the donut hole, you paid 100% of the cost of your drugs. Now think about that for someone who's really sick. Let's say they were on a drug at $1,000 a month. They had to pay it. What Obama has done here, he's taken a donut hole, if the law stands, and closing it. You with me? This year, if you fall in a donut hole, you only pay 45% of the cost of the drug. Now that's still a lot, but it's not 100%, and it's not 60%. It's 45. I think next year it goes to 42. Then the next year it goes to 30-something. So again, not trying to be political, this is good for us seniors. This donut hole closing is good. Now, once you have spent out of your pocket what you spend in these stages here and what you spend here, and you spent $4,700, you're out of the donut hole. And when you're out of the donut hole, you're only going to pay 5% of the cost of it. Now, that's good, but you're pretty doggone sick to be out of that. So, it's good and bad, So anyway, my point is this. The drug plan, the minimum drug plan that's in place helps us. And it's going to help us even more as the years pass. You really I guess you still could go broke if you fall in a donut hole, but you're not going to go as broke as quickly because the parameters. So again, the drug company can use this plan. They can't make it any worse. They can't say, we're going to charge you $500 deductible. They can't do that. The government drives the bus. They can charge you $320. Some plans don't charge you any. Like I say, I have a plan that doesn't charge me any. But I shopped around. I found out. All right, now, you're going to have a hard time seeing this on the screen, so turn over to the chart that says Rich Grawer's prescription drug plan. I'm going to use me as an example, as a guinea pig, to show you what I did with my drug plan. And I'm giving it away. I bought a supplement. I'm not saying it's right for you, but I bought a supplement. I bought Plan F. All right. Every October 15th to December 7th, you are allowed, if you have a supplement and a drug plan, to change your drug plan with no problem. No penalties, nothing. Here's what happened to me. In 2010, you with me on the chart? 2010, I was paying $40 a month just to get into the drug plan. I didn't know any better. I took 3 drugs. Each one cost $4 for a 90-day supply through the mail. With me? Tier 1, generic drugs. One for cholesterol, one for blood pressure. I forget what the third, kidney stones was the third one. All right? I did the math. I took that $40.40 and multiplied it by 12. So it cost me $484. I took the $12 that I was spending every 3 months for my drugs, multiplied it by 4 quarterly, $48, added them together. I was spending $532 for drugs for the year. Every October, the insurance company has to send you a letter saying we're making these changes to your drug plan. Again, make a guess what most people do with the letter. They throw it away or they don't think it's important. I got the letter in October. I read it. Here's what it said. For 2011, Rich Grawer, we're reducing your premium $3.80 from $40 to $36. You follow along with me on this? They took the one drug and they raised it to $7. They took the second drug and raised it to $7. I did the math. I was actually saving money. So my wife and I decided we'll stay with the plan. The following October of 2011, I got the letter. We're raising your premium to $42. We're going to give you this one drug free. Oh, man, that's a good deal. Look what they did with drug number 3. I read the letter. And I did the math. Now look what my annual drug cost was. $956 versus $518. That's when I decided I'm not smart enough to figure this out. Because there are over 30 drug plans in the state of Missouri. So I use a health insurance broker that IES, our company, says is reputable and will do the best job for you. So I called him. First thing he asked me, I need a list of your drugs. Send me the list of drugs you're taking. Send me the dosage. I'll find you a better plan. Look what he found me. So I did not renew in 2012 with the other company. Look at the new company. My premium was $26 a month, cheaper than any that I had. All of my drugs, look what it costs, were free. All of my drugs were free. Had I not gone to the broker, I would have never figured this out. I wasn't going to call 30 companies. Now look what my cost was. Now I could go year by year. You can look at it and see what I've done. Look at the last year, 2015. Look at this year. Once my broker has got me in the system, his computer system, every October he calls me. He said, Rich, you still taking the same drugs? I said, yeah. He said, I found you a better plan. I thought, how in the heck did he find me a better plan than what I was on? Look what he found me. Here's what I'm on now. I pay $15.70 a month to get in the plan. All my drugs are still free. Look what I'm spending now. The moral of the story is, if you decide to go with original Medicare, Part A, Part B, buy a supplement, you need to buy a drug plan, do your homework every October with the drug plan. You can really whittle your costs. It really, really does pay off. All right, so here's a sample cost if you use original Medicare, Part A, Part B, a supplement, and a drug plan. It'll cost you $104.90 for Part B if your income is under, as a couple, $170,000. If you're single, it's $85,000. If you're over that, then it's going to be more than $104.90. There's a chart in here that'll tell you what it is. We skipped it. Part B costs $104.90. If you want Plan F, I just rounded it off and said $175 a month. A drug plan averages 30. I really got a good deal. I'm at 15, but that's the average, so I put 30 up here. Vision, if you want to buy a vision plan, many people don't anymore. Vision doesn't cover very much. You might get a vision plan for $5, $10 a month. Dental, $25, $30 a month. Bottom line, about $340 a month if you buy original Medicare, Part A, Part B, a supplement, a drug plan, vision, and dental plan, if you're 65. That's a ballpark figure. Now, I don't sell them, but I think that's pretty close. All right, now, let's take a look at the, now I didn't talk about Medicare Advantage first because this one is more complicated. You'll see in a minute why. And I'm not saying the supplements are the best for anybody. Part C is known as Medicare Choice, Medicare Advantage. Remember who drives the bus? The insurance companies. They make up their own plans. So, here you got to have Part A, you still got to buy Part B. Can't get away from Part B. And then you get an Advantage plan. Remember, the Advantage plans include drugs, vision, dental, gym memberships, and maybe some other perks, hearing aids, some other stuff. The insurance companies design their own plans. They name the plans Gold, Complete, Select, Preferred, whatever. The government pays the insurance company a monthly stipend or subsidy. Most of these plans include extras, no small or no monthly premium, pay as you go, usually HMOs. You with me? That's what these plans are like. Now, there's not as much transparency in these plans as in the Medigap plans. If you buy a Plan F, you know what you're going to get. If you buy a Plan K, you know what you're going to get. Here, every plan is different, so you've got to read the plan. Every one of these plans has a drug plan, so you must make sure the drugs you're taking are in that plan. If you got a favorite doctor, if you buy a supplement and he takes Medicare, no problem. You can go to him. What if your favorite doctor says, I don't take any Advantage plans, or I only take one Advantage plan? That's Essence. So if you don't buy Essence, you can't go to him without paying more. With me? When my wife and I had to decide what to do, I basically could care less about the doctors I see. She was very particular. She had a thyroid doctor. She had a female doctor. She had a orthopedic doctor. All right? So we looked and we called the doctors and said, which Advantage plans do you take? Because a doctor does not have to take every Advantage plan. We found out that all three doctors were in separate Advantage plans. So my wife says, I ain't doing that. And so we went the other way, okay, because of that. So it's very important to do your homework. Read the plan. Know what doctors are in the plan. Know what hospitals you can go to. I just had a lady call me living in Belleville, 90 years old. She was in an Advantage plan. She used to go to Belleville Memorial Hospital. And she called and she said, Mr. Grawer, what happened? I can't go to Belleville Memorial anymore. Well, Advantage plans drop doctors and hospitals all the time. They dropped her hospital. 90 years old, she didn't understand why she can't go there anymore. Well, because her Advantage plan now says you have to go to this other hospital. So she didn't quite understand it, and her daughter was trying to make her understand. Now, I'm going to give you a sample of Advantage plans and how they differ. I'm not going to use any normal insurance company, okay? I don't want to sway you. Let's call this one the Ajax plan, the Sunshine plan. If you go into the doctor with the Ajax plan, you pay 10 bucks. If you had the Sunshine plan, you'd pay 20. Let's say you had plan F. What would you pay?
Nothing.
What? Nothing. If you went into the hospital under the Ajax plan, the first 50 days cost you $50 a day. Over here, the Sunshine plan says you go in the hospital, the first 5 days are free. After that, it's $75 a day. If I go in the hospital with my plan, what do I pay?
1 to 20 free.
No. Hospital, not skilled nursing, Rich. Hospital, I pay nothing. Skilled nursing, let's talk about that. Well, I didn't put that up here. Let's say under this plan, skilled nursing says it's $15 a day. Under this plan, skilled nursing says it's $30 a day. My plan, the first 20 days are free. Okay? And if I have plan F, every day after that's free. There's no and again, I'm not trying to sway you here. All right? So do you understand where I'm going? Read the plan. I'm not saying they're bad. So look at the cost for an Advantage plan now. No premium, $104.90. No medical cost, but you pay as you go. Co-pays and deductibles. Drugs are included, vision included, dental included. Let me go back. I forgot one very important thing. Every one of these plans by law has to have an out-of-pocket max. So you're protected. Ajax has an out-of-pocket max of $4,000. Once you spend $4,000 on medical stuff, not vision, dental, or drugs, once you spend $4,000, the plan should cover everything at 100%. This plan says the out-of-pocket max is $3,500. I've seen some high out-of-pocket max at 65, low, 23. They all differ. Okay? Generally speaking, the out-of-pocket max is based on the size of the doctors in the hospitals in your network. The $2,300 out-of-pocket max, about that thick a book of doctors in hospitals. The one that has $3,500, that thick a book. The one that has $6,000, a bigger book. Because you got more choices, and the insurance company has to pay more doctors. Okay? So, summary. Medicare supplements. No network. Monthly premium. Must buy a standalone drug plan. No out-of-pocket max. Flexibility to change. No add-ons. Medicare Advantage. Restricted network. Zero premium. Part D's included. Other things are included. Out-of-pocket max between $2,300 and $6,500. Your ability to change plans is limited, and I'll show you why in a minute. All right, people ask me, who buys these? Who buys what? In general, here's what we have found. A lot of people who can afford the monthly premiums go here. A lot of people that were limited, they got hit with the 2008, 2009 401k, IRA meltdown. They tend to go here. Peace of mind. Like my wife said, I want peace of mind to know I can go anywhere. That's what she wanted. I followed along like an obedient husband, even though I could care less about that, okay? Over here, I like the idea of no premiums. I like the idea that if I'm healthy, I don't spend anything. I pay as I go. I can see anybody here. These people are satisfied with the doctors that they have to see. Idea of shopping, like options, etc., etc. Let me give you an example. Mom and dad, my mom and dad, in the same house, in the same family, both in their 90s. Mom was on this. Dad was on this. Lived in the same house. She was an old penny pincher. She picked every nickel and dime she saw laying in the street, even though she could hardly bend down. She watched where every penny went. She would yell at him all the time. Tony, you're paying 200 and something at 92. He was paying 200 and something a month for his Plan F. You're never sick. You never use the damn thing, she'd tell him. He would look back at her and say, but Helen, if I do get sick, I can go anywhere I want, and you can't. They both died of old age. Neither one of them used their plan. So I can see Mom up in heaven today still yelling at him, saying, hey, you dumb SOB, you could have saved Rich more money. You could have left him more money had you not spent that. But the point I'm making, they were both perfectly content with their plan, perfectly happy. Okay? That's the choice that the government gives you. And really, when you think about it, it's a pretty wonderful choice. I got about 5 minutes, 6 minutes. Okay. Now, the Advantage plans. There is a special rule that applies to them. And it's this. The first 12 months after you enroll in an Advantage plan, you have the right to switch back with what is called guaranteed issue. What is guaranteed issue and why is that so important? If you buy a Medigap policy when you're supposed to, you get into Medicare when you're supposed to, an Advantage plan or whatever, you got guaranteed issue, which means they can't ask you any questions about your health history. They can't give you a physical. They got to take you as is. Take you as is. I had a friend of mine who was seriously ill, dying of brain cancer. His birthday was January 1st. All right, on January 1st, he was turning 65. All right, and they didn't give him long to live, and he was spending all kinds of money for health coverage with cancer. You know what? At 65, on January 1st, he could sign up for Plan F, and they can't turn him down. And that's what he did. And so for the remaining 3 or 4 months that he lived, he got great coverage by paying a monthly premium of $165. And he had cancer and had bills that were tens of thousands of dollars, but they couldn't turn him down. That's what guaranteed issue means. So if you sign up when you're supposed to, you can't be turned down. When are you supposed to? When you turn 65 or when you leave your work plan. So you're past 65, but you're on a work plan, and you leave it, you retire, or you quit, they got to take you. It's guaranteed issue. You with me? Okay, now, people always say, well, can I switch plans during that open enrollment period from October 15th to December 7th? Basically, kind of remember this. You can go sideways. Medicare Advantage plan with one company, Medicare Advantage plan for another, no problem. You can switch during that open enrollment period. And you might look into doing that. Maybe the drugs that you're taking under this Advantage plan are not covered as well as the drugs under this plan. Switch. There's no problem. None whatsoever. Anytime you go this way, lateral, sideways, you can switch with no problem. I got a Plan F. I signed up for that in September. The following September, my anniversary date, there's a few rules different with Medicare supplements, but I can switch to a Plan F. No problem. Here's where you get into a problem. When you try to go from a lower plan to a higher plan. I got an Advantage plan. I get really sick. I've been healthy for 5 years. No premium. I get cancer, or I got a heart problem, or kidney failure, or whatever. I want to go to Plan F. Problem. Guess what you don't have? Guaranteed issue. They could turn you down, and they probably would. They probably would. Anytime you go from, you got a Plan B or Plan C, and you want to go to F, you got to go through underwriting, which means you got to take a physical, answer questions, and you could be turned down. Just keep that in mind. That's very possible and very probable that that would happen. I hope you can understand why. But those Advantage plans, now remember, they got an out-of-pocket max, so you're still protected. So keep that in mind. Missouri is what is called an issue age state for supplements, which means if you buy into a supplement at age 65 and you're paying, let's say, $170 a month for it at 65, 3 years later, the company raises everybody's rates. Now, if you were 65, you'd pay $170, but you're 3 years older. You're 68. If you were 68 and first signing up, you'd pay $205. But because Missouri is an issue age state, and you bought the supplement and you stayed with it, you didn't switch plans, you didn't switch companies, you're going to pay what a 65-year-old pays. It won't be $170, but it won't be $205. It'll be $190. That's what issue age means. That's a good thing for those people on supplements. My broker called me the other day. well, in October, and he said, Rich, I could find you a better Plan F. I'm paying, I don't know what $210 a month now. He said, I can find you one for $190. Save $20 a month, $240 a year. But I bought my Plan F at age 65, my original one. I am now 71. So if I switch, what happens to my issue age? It goes to 71. And I'm looking down the road. When I'm 85, knock on wood, I'll be alive. When I'm 85, I'll be paying what a 71-year-old pays or what a 65-year-old pays if I don't switch. Sounds confusing, but it's a good deal with supplements. Just quick review. Wealthy people pay more for Part B. You're going to pay more if you have more than $170,000 worth of income. Health savings account. If you're on a health savings account from work and you turn 65, immediately if you sign up for Social Security or Medicare, you've got to stop the health savings account contribution. If any of you are in that situation, you might want to talk to Steve or I about that afterwards. So if you are on a health savings account and still working, and you like contributing to that, don't sign up for Social Security, don't start Social Security, or don't sign up for Part A, even though it's free. You've got to stop your contributing to a health savings account. Rest of this stuff. Real quick, how much time we got? About a minute? Okay. You play a little game with me. Here's Bill. He's retired, age 65. He's in good shape, generally healthy, takes daily blood pressure medication. He's frugal. He lives on a budget. He wants to access his full range of health services, dental, vision, hearing. He wants coverage that provides a safety net should he get sick. He's not picky about the doctors he sees. What should his decision be? Advantage or supplement? Rich? Advantage. I think that'd probably be advantage. Here's Mary. She's at 65. She spends a lot of time visiting her grandkids who live in 3 different states. Generally good health, but she takes 3 drugs. Has a comfortable teacher's pension. She's getting $4,000 a month from her teaching days. That comes in every month. She wants to travel a lot. She wants to see doctors in hospitals when she travels. She wants peace of mind. What should she do? Yeah, supplement. You get where I'm going? Now, I think at the end of your packet, is it in there? Yeah, look at the last page of your packet. We're not going to do this now, but there's a quiz for you. There's a quiz, and it says, and all you got to write in here is A for advantage, S for supplement. We'll go through the first couple. If you want the freedom to choose your doctor and hospital, supplement or advantage? Supplement. Supplement. If you're healthy, take few drugs, don't care which doctor you see, which hospital you go to. Advantage. If you don't want to write 3 or 4 checks a month for monthly premiums. Advantage, because if, here's what I have to do. I got to write a check for my supplement. I got to write a check for my drug plan. I got to write a check for my vision plan. I got to write a check for my dental plan. That's the price you pay for being with a supplement. Okay? Hopefully, I've untangled a lot of this Medicare maze that you have. I will end by saying the government has given us 2 wonderful choices. Now, I will also say that the government is looking very closely at 2 things. Number 1, the Advantage plans. They are saying we are giving too much money to the insurance companies. $800 a month is too much. So just think of those of you on Advantage plans. If all of a sudden the government cuts the $800 to $600, think the insurance company's going to do something? They might say, we're going to raise your deductibles. We're going to raise your copays. They might. Now, by the same token, Congress and Obama is saying Plan F is too generous. Watch this in the news. Plan F is too generous. We need to do something about it because nobody has skin in the game. Okay? It covers everything. Now, that's why I said I can't promise you this. If you have Plan F and they drop it or change it, history has shown us they've allowed people to stay with it, but didn't sell any new ones. Last story, I got a friend, little guy, 60-something years old, lost his wife tragically. tragically. Really, really destroyed him. But his primary care doctor had a nurse in the office who was in her early 60s, and who he grew sweet on her. Every time he had a hangnail, he went to the doctor. He used his Plan F. If he had congestion, he'd go to the doctor, simply that he could see her and talk to her. Now, is he abusing Plan F? I don't think so. I don't think he's the type of guy that we need to worry about. But Obama is worried, and Congress is worried, that some people are abusing Plan F. They're going to the doctor or hospital every chance they get because they know they have no copays or deductibles. So I just want you to be aware. Watch what is happening to Plan F with the supplement, and watch what's happening to the Advantage plans on the other side. There could be some changes down the road. Okay, thank you very much. Within an hour, Steve and I will be around.